So I've mentioned at some of our previous media information sessions about other indicators that we're starting to look at to tell us about overall COVID-19 activity in the community. Another indicator that we're continuing to follow is test positivity. And our test positivity has also really reached kind of a point that it's staying about the same, which is around 12 to 13%. Certainly much better than 22, 23%, which we were a couple of weeks ago, but also certainly much higher than the 2 to 3% we were seeing prior to the Omicron wave. Throughout this wave and really throughout the pandemic, the HKPR jurisdiction numbers have been slightly lower than the province. So I understand that the provincial test positivity rate is at about 18% now. So our rate is lower than the provincial rate, but certainly is still higher than what we've seen prior to this wave. Another data indicator which we've not talked a lot about across HKPR, but has been available in other jurisdictions is wastewater surveillance data. The reason that we haven't talked a lot about it across HKPR as of yet is because we were one of the health units to receive this type of wastewater surveillance system or setup later, so it only became established just in the fall, and they're not as meaningful for rural health units with broad geographies. I think they're very, very useful for large urban centers that where the virus activity in wastewater can really signal what's happening in a denser population. But in a jurisdiction like HKPR, we know that there's large portions of our geography that might not be on a wastewater system. They might be on a septic system. And we can't have the technology in every municipal wastewater plant. At this point in time, we do have it in 2 locations and that we're monitoring. So one in Lindsay, where we're able to water virus signals in the sewer shed for Lindsay. And then the other location is in Cobourg. Right now, there's about a 7-day lag time between when the sample is taken and then when we are able to get the data. So it's not a type of data point that we're following day to day because there is that lag signal. However, what it has been showing is that really 5 to 6 days before we might see case numbers change, we are seeing a change in that wastewater signal. Certainly back in December, as Omicron became the dominant variant throughout Ontario and then into HKPR, we saw the wastewater viral signals increase significantly in both Lindsay and Cobourg. At this point in time, the signal in Lindsay appears to have come down a little bit. I think it is too early to tell whether or not this is a trend that is going to stay or if it's coming down to a plateau. And again, this reflects data as of last week because we do have a lag time from when we get the data. The wastewater viral signal in Cobourg has stayed about the same. It hasn't, at least as of last week, wasn't yet showing an indication that it was decreasing as of yet. So I'm sharing that data today because I know that it's something that's asked about in many other health unit jurisdictions. I think it's one tool in our toolbox. Less useful for us here across our region for a number of different reasons, but still one of the things to consider. The other indicators that we're continuing to closely follow really have more to do with outcomes associated with severe illness of COVID-19. So we speak about data related to hospital admissions, admissions to ICU, and deaths as a result of COVID-19 infection. The data, so we've gone back and compiled or summarized the data from January 1st of this year, so reflects about the last 3.5 weeks or so of data where we were in full Omicron wave. So since January 1st, we've had 39 admissions to hospital from COVID-19. We've had 12 admissions to ICU, and we've had 9 deaths from COVID-19. Now, this is certainly the highest numbers of hospital admissions and ICU admissions than we've seen throughout the pandemic. Currently, as of today, we have 20 individuals or 20 residents across HKPR admitted to hospital with 10 in the ICU. What's different about the Omicron wave compared to, say, the first wave of the pandemic was the first wave of the pandemic, we didn't have any vaccines, and we found that our most elderly residents, especially those in long-term care homes and retirement homes, were significantly impacted, with some homes seeing very high mortality from COVID-19. We have had, so of those 9 deaths since January 1st, 4 of those are associated with, are of residents in a long-term care home. So it's not that Omicron is a totally mild illness. It can cause severe illness, but we have other measures in place that are also helping to prevent that same severity of illness and death that we saw with the first wave of the pandemic. And so I think that that's, you know, a positive light throughout all of this.